Kids are heading back to school and a world full of germs.
Sounds like the name of a band. The world full of germs.
World full of
Here
germs.
with how to keep your family healthy and safe, Chief Impact Officer at Sharp Breeze Daily, Dr. Abby is back. Doctor, good morning.
It's good to see you.
Okay, so the biggest health concerns, obviously, what we've been through the last 3 years, and we're going back to class. Germs, what's going on right now?
Yeah, so the biggest concern right now, of course, is infection, especially COVID. So the CDC is actually reporting that there's been a higher number of kids being seen in the ER because of COVID, and so we want to be just mindful about that. And of course, going into fall, we start to see cases of RSV, we start to see flu, so all of these things tell us that we want to be prepared, we want to make sure we're up to date on vaccines, and so all of that's important.
It's a good reminder, we're not out of the COVID. COVID's still around,
Yes.
but in terms of when you say, how do we keep the kids healthy? Because now they're going to go back to school, and it kind of happens exponentially at that point.
Absolutely.
What steps do we take that don't take us back to where we were in 2020, for example?
So it's important that we get up to date on vaccines. So even here in our own county, it's a low percentage of kids that have been vaccinated. So for example, in that 12 to 17 age range, only about 14% are fully up to date on vaccines. So we want to make sure that we get caught up with vaccination, and then just making sure that kids are sleeping well, they have a good sleep routine, they're exercising. If they have any chronic conditions, you stay up to date on that. So check in with your doctor just to make sure. And it's a big adjustment, right? Going back into school. So everyone should be mindful of that, making sure you're being mindful of their mental health and yours as well as we make this transition.
I sent my 4 kiddos back to school yesterday, and I had this big meeting with them, and we went down, and one of the little things, the bullet points was the return of, and they all knew when mommy looked, it was that we're gonna get sick again. I mean, it's just part of having kids back to school. So I put hand sanitizer in there, I got their tissues in there, and I asked them to please, please, please just keep washing their hands all day. Is there anything else that I could tell them to do?
That's very, very good. Making sure that we're still keeping up with those practices of hand washing and making sure that they're being mindful when they are playing with other kids, with sharing, when they're sharing things, things should be wiped down, and making sure that we realize that it is safe to go to school, and we don't want to cause panic and fear. It's safe to be in school and to be around other children, but we just have to take some precautions.
Poway goes back today. A lot of other school districts already started. The big one is on Monday, San Diego Unified. For those who haven't gone back yet, and we're waiting until Monday, anything we can do today to prep? What Shali said is great. Teach the washing of the hands, have the hand sanitizer, anything. But what can we do now to get ready for Monday?
Yeah, so make sure that you prepare, right? That's the biggest thing, because routine is always great. So have a plan to make sure that you're adjusting to making sure that they have breakfast, and make sure that they have everything they need in terms of their health. If you haven't checked in with their doctor, make sure that you do that. And if they have a form, for example, some kids have chronic conditions like asthma, and they need a form, a plan that tells the school medical providers what needs to happen if they get sick. So make sure that you are up to date on that.
I remember during COVID time, I was bringing back memories of the kids going back to school and how much they missed during COVID time, and how everybody's back in school. And I remember there was the smallest sniffle, I would pull the kids out right away. But they've already missed so much that sometimes you're like, it's just a little runny nose, they're gonna be fine, just leave them in there. So when do you know, now that we're in this new day and age, that it's time that they need to stay home, and time that they can actually stay at school, maybe just put on a mask and go to school?
Yeah, so a number of things. If they have a fever, so essentially if their temperature is 100.4 and over, then you want to keep them home. If they're vomiting, if they have diarrhea, they can't keep anything down, then you definitely want to keep them home. If they're in pain, then of course make sure that you keep them home until you try to figure out what it is. If there's any coughing, if they can't really breathe, then also make sure, of course, you seek urgent medical attention in those cases if they have severe symptoms. But it's good to have a test. I would say stock up on those home tests, because if they're sick, test them and make sure that they don't have COVID, because again, we don't want to spread these infections, and we want to keep the rates down overall. So
but if they have like a little runny nose, can I just put a mask on them and
Sure. Yeah. If they don't have any of those things, so if their test for COVID is negative, if they don't have a fever, if they can keep fluids down, and they don't seem generally like they're lethargic and tired, then yes, you could do that. But it's important to make sure that you test first to make sure that they don't actually have COVID.
That's good advice.
Dr. Abby, always great information. We know you were a good student. Obviously.
Some of the time, some subjects no, but I made it through.
Yeah, you made it through, all right. We thank you this morning. Appreciate the time.
It's good to see you.
All right.